the Army Corps of Engineers has been in contact with us here locally, and as you may have seen in several other communities, what they have done is they have gone in and in essence constructed alternative care facilities, not hospitals per se, but hospital-like facilities, and then they've turned them in essence over to the state or local governments to work with the hospital systems to provide what I would describe here as a phase 5 in terms of expansion of bed capacity in the event that we need it. And that to me is the key phrase, in the event that we need it. I think every single one of us on this call are hopeful that we have current capacity in our hospital system so that when the surge comes, that we will have an adequate number of beds, that we'll have an adequate number of ICU beds, and we'll have an adequate number of ventilators.
As we work closely with our health departments, the Office of Emergency Management data team, and our academic partners to gain a better understanding of the effects of COVID-19, there are no doubt parts of our community that are currently more affected than others. And while the overall rates of confirmed cases as compared to our population is around 100 confirmed cases per 100,000 of populations, there are portions of our county that lie much closer to 250 confirmed cases per 100,000. The reason I mention this is because that number is concerning. It's concerning because that number is similar to where cities such as New York were less than a week ago.
And look, this isn't about an abundance of caution. That is our job. We always have to make assumptions to be prepared for a worst case scenario and hope and work diligently to avoid it. Again, the mayor will be the happiest guy in the city. I'll be the happiest guy in the county if we get a build out and a building that we don't have to use. But we're going to be darn sure that we're ready. And I think the common belief among everybody involved here is we owe the people we all serve no less than to be ready to shoot for the absolute best outcome, but to be ready for the worst.
So as we've seen in other cities and countries, when COVID-19 spread and illness reaches a certain point, even the largest and most efficient hospital systems at times may require further support outside of their four walls. And for this reason, with the leadership of County Executive, of Mayor Barrett, of Mayor DEVINE, of West Allis, and all the mayors, the state fair officials, our health systems, and our health departments, we are moving forward in obtaining available resources to create a facility that, in the situation in which we would need increased space and increased medical capacity, we would be able to provide care for our citizens in need. The state fairgrounds provide an optimal location for this space, considering the ease of access, abundant parking, central location to a variety of resources.
We appreciate the guidance of Dr. Weston, the Army Corps of Engineers, as we continue to work with state and federal officials on determining for Wisconsin and for metropolitan Milwaukee if State Fair Park facilities could meet the need of an alternative care facility. Now that has been decided, we at State Fair Park are ready to serve if needed. And as everybody had indicated, we hope it is not needed, but State Fair Park board and staff are prepared to do our part to assist. We have the facilities, we are ready, and we are looking to make sure that we are operational as quickly as possible to provide services we hope are never needed.
We certainly hope, as the mayor and the county executive said, that we will not reach the point where we will need to use this location. But more than that, we want to avoid a situation where we decide we need this facility too late, when we already have patients in need.
We're going to do everything we can to make sure this has a minimal impact on the surrounding neighborhoods. And this is going to be a very smooth operation. Like Mayor Barrett said, we hope we never need it.
So our city, our county, and our municipalities are working proactively, and I think wisely, to plan for the care of all of our citizens, wherever they may come, or whenever they may come.
There's also the issue of personnel and PPE, the personal protection equipment, which is a different issue. Those are different issues, but obviously very, very important to what we're talking about. So oftentimes I think people are critical of government because they're saying that they're not preparing. This is an attempt to prepare in the event that we need this. Now, when I say when we need this, we are talking 10 days to maybe 21 days.
The Army Corps of Engineers would be outfitting the inside of a structure. So we're not putting up a new building or anything like that. They're just taking an existing space and modifying it for medical care.
That, of course, is not the end of the story, because along with the actual beds themselves, we will need to know whether our hospital systems, other healthcare providers have both the personnel and the personal protection equipment necessary to run these facilities. And that's part of the analysis that's going on in real time today, whether they can do it, whether they'll be able to, if we get these beds in place, and if we need these beds, whether we will be able to actually run them. So that
the areas that are certainly hardest hit by this are the central part of the city of Milwaukee, and then the north end of the city of Milwaukee. There's no doubt that COVID is affecting our entire county, every part of our county. However, those are certainly the areas hardest hit. We are hoping in the near future on our county dashboard to include a little more information about our most affected zip codes to better tease that out. So you can watch for that. But for now, it certainly is the central part of our city and the north part.